702.
Health and Wellness.
11:35, time for our health and wellness feature. And today, I want us to have a conversation about the role and effectiveness of herbal and traditional medicine in healthcare. Do you use herbal or traditional remedies in your household? And what do you use those for? Maybe it's mhlonyani, because some people use it for colds, or maybe you use rooibos tea, for instance, for digestion, or maybe, alu for the skin. What do you swear by? Like, what are those home remedies, the traditional remedies, herbal remedies that you still use in your household? Give us a call on 011-883-0702 or send a WhatsApp voice note. For generations, and for many, many years, South Africans have turned to herbal and traditional medicine for healing, through whether you're doing that because you want to heal from some coughs, maybe you want to soothe some coughs, or you've got stomach aches, or maybe you want to manage a more serious health condition. I mean, even with modern clinics and pharmacies all around, you see traditional remedies remain that trusted part of many households. Some people say that they work better, others use them alongside modern treatments, and for many people they are a reflection of our culture, of our heritage and faith, and they stick by them for many, many, many years. So how effective and relevant are these remedies today, and can they really supplement modern healthcare safely and successfully? And how can the two worlds of medicine, actually, the traditional and scientific, work more closely together to serve communities better? Godfrey Madlalate is a herbalist who is joining us on the line. He's going to guide us through this conversation, but I'd like to hear from you as well. I know there are many families, many households who still use herbal and traditional remedies, and they've worked. I mean, we were raised by those remedies, and look at where we are now. And some of us have taken that over even into our own households. Godfrey, thank you so much for making time for us. Good morning.
Good morning, Clement. Good morning to your listeners and all the gogos and the mkulus in the SADC region as well.
So there are many people in this country who still tend to your traditional or herbal remedies. Why do you think these forms of medicines remain so important today? Because in some way, that's become sort of consistent in many households.
I think all over the world, Clement, we do have indigenous traditional communities. And, despite modernization and westernization, I would really like to categorically say that our first point of call in terms of medication as a traditional and indigenous community should vest in traditional medicines. Also, we have seen over years, and I'm sure the clinicians and all the doctors globally have documented that some people just don't respond to Western medicine and drugs. Yeah.
I see. So how would you describe then, because there are some people who often, say, yeah, sure, I'll take the modern medicine, but I need to supplement it with some herbal or traditional remedies. How would you describe that relationship between traditional medicine and modern healthcare in South Africa right now? And are we finding ways for these to complement each other? Because there are doctors who will also sometimes tell you that, hey, try this as well when you get home, this herbal remedy, this traditional remedy, on top of what they've given you as, for lack of a better phrase, the modern medicine, so to speak.
Yes, I think what I've realized in during my healing career, and I'm sure all the traditional healers and herbalists will agree, is that in the modern times we live in, it is inevitable to have a mix of both, formal Western drugs and medications. Being used successfully alongside traditional medicines. Remember, in the South African health context, Western doctors are supposed to refer people to us when necessary, and vice versa. We do refer some of our patients as well to to hospitals and clinics and general practitioners. So for me, the key has been that if you have a patient who's both on Western medication as well as traditional medication, the key is to create synergies between the two. And that involves, considerations around the time as to what time do you administer the tablets versus what time do you administer the traditional remedies. Traditional remedies can be quite strong, so some of them will also have a tendency of flushing out the tablets from within your system. So if you have someone who's on a chronic condition, it could be diabetes, it could be high blood pressure, it could be something else. If they take traditional remedies at the wrong time, it will definitely flush out the tablets and it could be cough mixtures and other things as well.
I see. So someone is asking on the WhatsApp line that when we talk about herbal remedies or traditional medicine, what exactly do we mean when we talk about that?
Traditional medicines are wide and vast. You will find that at least 90% of traditional medicines are derived from herbs and shrubs and barks of trees and plants. We do obviously, with experience, mix them a bit with other supplementary medicines, which might be chemicals at best. I'm talking about the kind of chemicals you find in the periodic table if there are complications. So people like talking about the word concoction. You will find that each healer has their own unique concoctions, which are mixed differently from one healer to the next. What I haven't mentioned to you and about the whole issue of using herbs and traditional medicines in general is that it's not as easy as it seems, which is why it has been difficult in certain cases, especially with abangoma, your classic traditional healers, kunamagedla, kunabangoma, and all other kinds of healers. It's difficult to use traditional medicines in a space where a specific ancestral context hasn't been defined. In other words, the efficacy of traditional medicine has to achieve synergies that are associated with your own unique ancestors and allergies that are unique to your own ancestry. So a few years ago, I wrote a paper which was presented to the department, our Department of Health, to say that each and every traditional herb or piece and item of traditional medicine has got a sacred coded signature, ancestral signature, which is purely defined and controlled by an individual's ancestors. So, Madlalate, there are certain herbs that are not compatible with that ancestry, and if you were to administer those herbs to me, I will react in a very adverse way. In Western terms, they will say I have an allergy or an intolerance of a certain herb. So the beauty of traditional medicine and traditional herbs is that it is a network of family secrets that is being brought together into the same arena and the same space. And that is the beauty. This is why we encourage broader society to consult with traditional healers before they can use traditional medicines, because traditional medicines can be dangerous if one tends to self-medicate. They are not good for self-medication. They are good to use once one has consulted a healer and this healer has thrown bone or done an ancestral, a prophetic divination to say, will this be effective on Mr. Clement Manyathela or not? So we will normally get an answer.
Yeah.
So we don't just prescribe. It's unlike doctors when they have a manual and they say somebody who's presenting symptoms of a flu can be given ABC, It doesn't work like that. It's actually slightly more complicated.
Okay, so because there are many, there are some of us who sort of will still use some herbal or traditional remedies, but we've not done the necessary consultations. We're working on the information that's been provided by our own elders or our parents, Could it be that then they probably, or their elders, have consulted about these, and that's why that's become quite known within the family structures that these are the kinds of medicines that we take, but the consultations have been done by those that came before us, because we take these now because we've seen them work, but we have not done any consultations.
Yes, that happens a lot. I think that context draws on knowledge that has been shared throughout the generations. I heard you earlier on as I was logging in, you were talking about umhlonyane, that umhlonyane is a herb that deals well with flu and fever. And we also discovered some magic during COVID-19 spell, that the pandemic, that umhlonyane stabilized a lot of people during the COVID-19 pandemic. So that is based on generic knowledge of traditional, indigenous traditional systems. But then on the other hand, it doesn't necessarily mean that umhlonyane will deal with each and every case of flu. Some people might react very adversely to umhlonyane and draw an allergy from it. I'm just citing that example, yes.
Got it. I've got some messages coming through on the WhatsApp line, some calls as well. We'll get to them after the break. It's 13 minutes now before 12.
7:02. Health and wellness.
11 minutes before 12 o'clock. We're having a conversation this morning about the role and effectiveness of herbal and traditional medicine in healthcare. Some of the messages coming through, Moses says, Clement, my rural experience would wake up early in the morning, go to the kraal, milk a cow directly into our mouth. That's a good laxative for the day. It works wonders. And then Paul on the WhatsApp line also says, good day, Mr. Manyathela. There's no nation in the world that has never used plants and herbs to heal the sick or prevent. Before the advent of medicine science, we too, for centuries, used or still use what the West call traditional remedies, but it works. However, some academics or former academics in some public institutions commercially exploit our indigenous knowledge for their personal benefit. That's sad. That's a message there from Paul. And then Paul says, I'm a dietitian and I'm trained in functional nutrition in the US. We have manual that details drug herb nutrient interactions. The Western and Asian herbs are well researched and documented. The problem is that the manuals don't have a lot of the herbs or traditional medicines that are found in Africa, or we just don't know the English or scientific names for those. That's a message there from Mpo. Here's a WhatsApp that's also come through.
Good morning, Clement. Can you please ask the traditional healer if they can prescribe herbs without associating them with ancestral issues and stuff? For instance, I'm a Christian, but I believe in natural herbs than Western medication. But almost everybody I know who trades herbs are always associating it with some traditional ancestral connections, and that becomes more against my faith as well.
Lovely. Thank you so much for that. Yeah, Godfrey, yes, you can respond to that question.
Yes, thank you very much. What I need to say is that our generic belief as traditional healers is that God controls biodiversity, controls vegetation and everything associated with it. Our main belief is that God and the ancestors, during the creation of the universe, they facilitated a situation where herbs generally and plants generally grow in a specific pattern across the planet. And when you analyze that situation, you find that those herbs and plants grow as per the expected clinical conditions of those people in that region. That is why the location dynamics of herbs cannot be the same all over the world. If I may cite an example, moringa is not indigenous to Southern Africa. It was derived from India and transplanted to Southern Africa, and now it's being commercialized at a large scale. But it's not necessarily one of our proper indigenous herb in the Southern African region, as much as it's now growing in huge numbers, in huge quantities rather, in places like Mozambique. Now, the reason why that was a factor is that if you look at the regions of the world, the SADC region included, our physiology and anatomy, the growth of herbs and the planting of herbs by the powers that be, I'm talking about God Almighty and working with the ancestors, guides that entire process as to which herbs are most relevant for a specific region. So what grows in the Amazon, what grows in India and China, and what grows in Southern Africa is not the same. So that's question number one. Question number two, yes, I heard the listener talking about his Christian persuasion and background. That's fair enough. That's okay. I think even if he is a Christian and he is using herbs, he will get resolved to some extent. However, he will not access all the levels of the action of the herb without a proper dialogue with the ancestry. And I think this whole thing, I must say to you, Clement, and your listenership, this whole thing of separating Black Africans into Christians versus the ones that believe in traditional religion and so on, is very unfortunate. Unfortunately, it's a religious matter. It's just like politics. It does divide people across very strong ideologies. But it is a very unfortunate scenario, because what happens in as I spoke last time, in pre-colonial Africa, is that we are traditionally a people that believe in African traditional religion, which doesn't reject God, which has its own version of its, of its own Christian independence, which is African in nature. But I won't dwell into that today. So, but he is most welcome to use traditional herbs, as much as he will not uncover all their benefits. Yes.
Yeah, no, true. And as I said earlier, I mean, I have seen people who are Christian who still use herbal remedies, traditional remedies that work for them. I've seen someone who had cancer who is Christian, who has also dabbled in, just supplementing, the so-called modern medicine with traditional and herbal remedies, and it's actually just worked for them. They didn't have to go for consultations, which is why I asked, could it be that because though maybe the ones who came before us have done the necessary consultations, or it could very well be that there hasn't been, but this is something that's worked for them. Here's another WhatsApp voice note that's also come through.
Hi, Clement. I'm listening to your guest there. There's a point you made regarding being given medication or herbs which are prescribed to you, specifically to you, to avoid our allergies. But there's a question I have to say. I've been to traditional healers who dispense the same kind of medication to everyone that attends to them. And I've always had a problem with that, not understanding how so. What does he has to say regarding that? Because most traditional healers, they have a standard medication treatment, so-called, that they give to their people, and I don't understand it. And I think he's agreeing with me. Can he explain what is the meaning of that?
Okay. Godfrey, before you explain that, can you also address this question around the concerns out there about fake or unsafe herbal products on the market? How can people tell what's safe and what's not? If you can do that quickly, please, because I've got about 30 seconds left.
Yes. Safety of traditional medicines is key. Unfortunately, we are in a period of transition where we are trying to, as much as possible, despite the problems that we currently have registered with the Department of Health, we are trying to standardize the practice of traditional medicine in this country so that it can be formalized and professionalized. Now, during this transition, it is difficult to account for the kind of herbal concoctions you find at your retailers and your stores where we get our toiletries and stuff. What I would say is there is no standard in this country for the packaging and bottling of traditional medicines. Also, that standard would have to account for the ingredients and specify them in volumetric means and percentage means and so on. We are hoping that in future we should be able to interact with the South African Health Products Regulatory Authority, which is SAPRA, once we have addressed all our niggling problems with the Department of Health, so that matter can be standardized. I must also stress that, however, the handling of traditional medicines and remedies, it is very sensitive. So people that are traditional know that, for example, when you have just faced a bereavement, it doesn't matter whether you are male or female, or when you are female and are going through your menstrual periods, you cannot touch traditional medicines. So the commercialization aspect of traditional medicine is very complicated when it comes to those considerations. Same as people that get their traditional medicines via courier. You don't know who touched them in the process, and they could be violated by the time you receive them. Yes.
Yeah, Godfrey, we're out of time. I've got to leave it there, but we'll do part 2 of this conversation with you soon. Thank you so much for making time for us.